Namaste. Welcome you all for the yoga session. In this session, we are going to use a chair, a mat, and a blanket. Our focus will be on the practice of Prasarita Padottanasana. We are going to use a chair. This is a standing forward bend posture, which is very greatly relaxing. We are also going to add few postures in between to make this practice more effective. We shall begin with some preliminary postures for the core muscles. Lay on your back, resting the legs on the seat of the chair. Keep an appropriate blanket below the neck. Ensure that the complete spinal muscles are properly rested on the mat. Keep both the palm on the abdominal cavity. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. While you exhale, contract the abdominal muscles little more than normal and specially sensitize even the posterior region, that is the region of the lower back and the fascia, the thoracolumbar fascia at the back, that should also respond to the breathing. Be watchful. Good breathing is very essential in all the postures. This breathing should be maintained in all other movements that you are going to practice. A good abdominal breathing also helps the mind to relax. Now relax both the arms. Keep them by the side of the trunk, palm facing down. As you inhale, rise both arms up over the head. Then as you exhale, bring it back. Match the action of the breathing. Feel the weight of the arms as you move them up and down. Inhale up. At the end of the inhalation, it should have reached the ground again over the head. Then as you exhale, bring it back, taking the palm to the sides of the, and at the end of the exhalation, the palm should land on the mat. Match your breathing and the action. This is good for the scapular region, the shoulder joint and the arms. A good way to also improve the depth of inhalation and exhalation. Also feel the position of the arms, especially when you close the eyes. You must feel from within the position of the arms as they move up and down. That is, our ability of proprioception improves if we are able to move them as synchronously as possible. As you inhale, you must lift the arms. And also ensure that as you inhale, the abdominal cavity expands. Then as you exhale, contract the abdominal muscles and also move the arms. Watch the shoulder joints. Watch the scapular region. Watch the chest. Chin towards the chest. Feel your arms. Feel the weight of the arms as you move them up and down. Now relax the arms. You can fold the elbows, resting the palms on the abdomen and chest. Rise your right leg up, stretch the heel, pull the kneecap, tighten the quadriceps, the top of the thigh. Pull the kneecap, feel the hamstrings, back of the right thigh. This is a good stretch. Simple but very effective stretch for the back of the thigh, the hamstring muscles. You have to stretch the toes towards the knee. Stretch the calf muscle. Now flex the knee. Keep the right leg down. Chain, left leg up. Pull the kneecap. Stretch the heel. Tighten the top of the thigh, the quadriceps. On pulling the kneecap. Left leg down. One more time. Right leg up. Pull the kneecap. Stretch the heel. Keep the right leg absolutely straight. Toes towards the knee. That will help the Achilles tendons to stretch, which will reinforce the stretch of the calf muscle, and this in turn intensifies the stretch at the hamstrings. Right leg down, chain, left leg. The tone of the hamstring muscles is very important even for the back to be healthy. So this movement also helps the hips and the lower back. And all this breathing is very attentively be done. Left leg down. Relax your breathing, watch your back, rise your right leg up, fold, hold the knee, press the knee closer to the chest. Stretch the toes towards the knee. And activate the right hamstring muscles. That is, press them against the calf muscle by tightening the hamstrings so that you can feel the knee capsule. And draw the knee inline and closer to the chest. Release right leg, chain, left leg. Left leg up, fold, hold the knee, press the knee closer to the chest. Activate the left hamstring muscles so that you can feel the knee capsule. And breathe properly. As you inhale, the abdominal cavity expands. As you exhale, it contracts. This is a good movement for the gluteal minimus and medius, and also helps the lower back muscles. Release left leg. One more time, right leg up, fold, hold the knee, press the knee closer to the chest. From the hands you should pull it closer to the chest, but ensure that the hip, knee and ankle, they're all in the same plane. Release the right leg, chain, left leg up, fold, hold the knee, pull the knee closer to the chest. Breathe properly. Make the exhalation a little slower than the inhalation. Make the exhalation more profound by contracting the abdominal muscles a little more than normal. Release left leg. Right leg up. Fold from left hand, hold the ankle joint, pull it closer to the root of the left thigh and push the right knee. Take the heel as close to the root of the left thigh as possible and watch your breathing. As we inhale, try to feel the base of the spine, and as I exhale, contract the abdominal region. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh from left hand, push the left knee towards the chair. This is a good movement for the base of the spine, especially the sacroiliac joint. That is the joint where the hip and the spinal column meet. Even in this, tighten the hamstring muscles, back of the thigh, so that you can feel the knee capsule. Release left leg. One more time, right leg up, fold from left hand, hold the ankle joint, pull it as close to the root of the thigh as possible, then push the right knee. So these simple movements give a good tone for the core muscles, especially in the lumbar, pelvis and hip complex. So these are some very safe starters for any other movements to follow. Release right leg, chain, left leg up, fold from right hand, hold the ankle joint, pull the heel closer to the root of the right thigh and push the left knee towards the chair. Breathe consciously. Breathing is the key for the success of any posture. Get connected with the breath. Get connected with the posture. Release left leg. Watch the complete paraspinal muscles. Right leg up, fold from left hand, Hold the ankle joint, pull from right hand, push the knee across the chest. You have to pull powerfully and then push across the chest. Feel the stretch in the gluteal region, especially the gluteal maximus muscle gets a good stretch in this posture. Breathe well. Be aware of your breath. Release right leg, chain. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. The gluteal maximus muscle is one of the major muscles of our body, so this posture gives a good and intense stretch for the gluteal maximus muscles. You have to push the knee across the chest so that you get a more penetrating stretch. Release left leg. One more time. Right leg up, fold from left hand, hold the ankle joint, pull from right hand, push the knee across the chest. Feel the complete hip musculature. Feel the muscles of the lower back. To feel the muscles of the lower back or the posterior surface, you should use your breathing to sensitize that region. Release right leg, left leg. Left leg up, fold from right hand, hold the ankle joint, pull from left hand, push the knee across the chest. So this posture is also one of the very important postures for the health of the back. Release left leg. Just watch the posterior surface, the region of the lower back. Right leg fold, resting the heel on the left knee, then from left hand pull the left thigh and from right hand push the right knee. And you have to stretch the heel, both the heels, toes towards the knee. Feel the root of the or base of the right hip deep inside. You should get a good stretch. You must pull the left thigh. Now release the left thigh, then rest the right leg also on the chair. Fold your left leg, resting the left ankle right on the knee. From right hand, pull the right thigh, from left hand, push the left knee. You have to pull the thigh so that the heel is almost at the edge of the seat of the chair, and tighten the hamstrings. Breathe well. Feel the stretch deep inside the left hip. Release right leg. Rest the left leg also on the chair. One more time. Fold right leg, resting the heel on the left knee. From left hand, pull the left thigh. From right hand, push the knee. Breathe well. So this is a good stretch for the so-called piriformis muscle, which is located deep in the hip, and the sciatica nerve passes adjacent to this. Therefore, this stretch is also very useful. Release the legs, rest the legs on top of the chair, change, fold left leg, left ankle on right knee from right hand, hold the right thigh, pull from left hand, push the left knee. Keep both heels active, toes towards the knee, and breathe well. Feel the complete region of the hip. Release right leg and rest the left leg also on the seat of the chair. Rise both legs up, fold, hold the knee, press the knee closer to the chest. Stretch the heel, toes towards the knee. Knee as close to the chest as possible. Breathe well. Here the abdominal cavity. During inhalation, feels a better massaging effect because of the pressure of the thigh, and because of the same reason the thoracolumbar fascia, the thick skin at the back, that responds better to the breathing. Just watch that region as you inhale, exhale. Also here, tighten the back of the thigh, both legs, so that you can feel the knee capsule. The outer covering of the knee also gets enhanced stretch. Or release the legs, rest them on the chair, breathing relaxed. So this in some sense is a series of postures that would help the core muscles in a gentle way, and they prepare these core muscles for further action. Slowly get up from the right side. Sit on your heel and sit upright. Sit upright on your heel in Vajrasana. Keep a blanket below the knee. Chest and navel up. Watch your breathing. We are going to do the following. Hold the chair, take your right leg forward, right knee bent at 90 degrees, chest and navel up, and then gently flex the right knee as much as possible. Press the right foot. Hold the chair so that you get a good orientation for the trunk. The pelvis should not turn. So chair helps to get a good orientation. Watch the line and length of the left leg. Take care of the orientation of the left leg. It should not sway sideways. In this posture, the right hip is in flexion, left hip is in extension. This is a very good posture for the hip flexors. One of the important movements which would help the practice of other postures. Slowly come up, right leg back, chain, left leg forward, press the left foot, then gently flex the left knee as much as possible, chest and navel up, look forward. Watch your breathing. Watch the base of the spine. It's also good for the knee. Left knee is in flexion, right knee is nearly neutral, left foot is in dorsiflexion, right foot is in plantar flexion. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. The differential movement at the hip is very beneficial for the base of the spine. Slowly come up, take your left leg back, sit on your heel. Keep the complete spinal column well aligned. Stand up. Stand in front of the chair, close to the chair. Rest the wrist on top of the chair. Spread the legs about 3.5 to 4 feet. Foot parallel to one another. Turn the foot slightly inward and move the foot little back so that you can stretch the arms and the trunk. Arms and trunk parallel to the ground. Pull both the kneecaps. Be strong on both the legs and maintain the integrity of the spine. That is, do not buckle the spine. In this forward bend, you should ensure that the trunk does not flex. The forward bending is accomplished by hip flexion. So there is no trunk flexion. You have to stretch the trunk. Keep both arms straight. Relax the neck. Breathe well. Pull the kneecap. Feel the gluteal or the hip muscles. Feel the hamstring, back of the thigh. Press the outer edge of both the foot. Increase the arch at the feet. As you inhale, the abdominal cavity should expand. As you exhale, it should contract. Be aware, be watchful. Both arms straight. So this is a very relaxing posture. You have to rest the wrists, activate the muscles of the upper arm, forearm, stretch the trunk, be strong on both the legs, press the foot, increase the arch, pull the kneecap. Slowly come up, join the legs. Sit upright on your heel. So with the help of the chair, it is easier to do this. You can stretch the arms, you can orient the trunk properly. And this type of forward bending is very useful for the trunk also. If you bend forward in a wrong way, one can invite problem to the spinal column. So this also tones the muscles for proper forward bending. Kneel down, right leg forward, bend, hold the chair, stretch the right foot to press against the lower rib of the chair. Keep the right knee flexed. Chest and navel up, press the heel down and pull the heel towards you and push the left knee. This action activates the back of the right thigh, the hamstring muscles. Ensure in the beginning to keep the knee slightly flexed. Then gently straighten the right leg. Extend the knee completely, pull the kneecap, straighten the quadriceps, chest and navel up. So this will ensure a good stretch for the Achilles tendon, the calf muscle as well as the hamstring muscles, the back of the thigh. For that you have to raise the chest and navel up. So this is where the chair helps you further. It gives a good support for you to push the right thigh down and lift the navel and trunk up. Slowly take right leg back, chain. Left leg forward, foot against the lower rib of the chair, left knee slightly bent to begin with. Press the left heel and pull towards the right knee so that the back of the thigh becomes active. Chest and navel up. Then gradually extend the left knee, pull the kneecap, stretch the heel, push the root of the left thigh down, lift the trunk and navel up. This is a very useful posture to tone the back of the thigh, the hamstring muscles. One of the very large muscles group that we have, and it has a very high degree of participation in many postures. Slowly take the left leg back, sit upright on your heel. Ideally, heel should be together and hips should sit on the heel. Watch your breathing. Slowly get up. Put a blanket on the seat of the chair. Stand close to the chair. Stand upright in Tadasana. Bend forward. Rest the palms on the chair. Spread the legs 3.5 to 4 feet apart. Foot inside. Press the outer edge. Both legs straight. Move slightly back. Adjust the distance between the legs and the chair. Stretch the trunk, bend forward. Flex the arms, rest the forehead on the blanket. And then flex the arms on the seat of the chair. Both legs straight, stretch the trunk and rest the forehead on the blanket. Keep the eyes closed, no pressure on the eyes, a soft pressure on the forehead. Legs straight. Pull the kneecap. Activate the gluteal muscles. Keep the neck relaxed. As you inhale, abdominal cavity should expand. As you exhale, it should contract. Rest the forehead properly. So these rested forward bends are very, very relaxing. find benefit both at the physical and psychological levels. These rested forward bends helps to bring in good harmony between sympathetic and parasympathetic nervous system and induces a good sense of relaxation. But one has to stay for a minute or little more than that to feel the benefit. And here is where these kinds of supports like chair and blanket help. Press the palm on the seat of the chair, slowly come up. Sit upright. Stand up. Sit on the chair. Sit to your right side. Press the foot properly. Chest and navel up. Hold the top of the chair. Inhale, exhale. Turn to your right side. Grip the chair and turn. Keep the shoulders even. Turn the neck also in the direction of the twist. With every inhalation, you should stretch the trunk. With every exhalation, you should twist the trunk. And then watch your breathing. As we inhale, the abdominal cavity should expand, and as we exhale, it should contract. Do not hold the breath. Twisting postures help relieving the stress in the lower back, also helps the intestinal organs. Slowly come up, change sides, sit to your left side. Sit upright. Hold the top of the chair, inhale, exhale, turn. Use the grip. Use your forearm and upper arm to induce a good stretch for the rotators of the trunk. The oblique muscles of the abdominal region also stand to benefit from twisting, and proper breathing ensures good massaging effect on the intestinal and pelvic muscles and organs. Slowly come up. Sit upright. Stand up. Sit on your heel. Watch your breathing. Stand up. Keep the blanket on the seat of the chair. Spread both legs 3.5 to 4 foot apart. Rest the wrist on the top of the chair. Stretch the arms, stretch the trunk, pull the kneecaps, press the outer edge of both the foot. Be strong on both the legs. Feel the muscles of the legs, muscles of the arms. Feel the complete trunk. As we inhale, abdominal cavity should expand. As we exhale, it should contract. It's also good for the complete abdominal cavity, the organs move slightly away from the spine due to the gravity. Trunk and arms parallel to the ground. Slowly come up, join the legs, Tadasana. Sit on the blanket in Vajrasana, sit on your heel. Chest and navel up. Line your chest, keeping the chair in front. Rest the wrist on the edge of the seat. Press the palm on the seat of the chair. Both arms straight. Relax the neck. Stretch the toes back. Tighten the calf muscle. This is a good stretch for the shoulder joint and also the upper chest. Neck also stands to benefit. Be strong on both the arms. Tighten the muscles of the upper arm and forearm. Press the palm. Middle fingers pointing forward. Relax the neck and if possible rest the forehead on the mat. Flex both arms and relax. Press the palm. Slowly get up. This gives a very good stretch for the arms, the scapulae, as well as the upper chest. Sit upright in Vajrasana. Watch your breathing. Stand up. Keep the blanket on top of the chair. Stand closer to the chair. In third asana. Rest the palms on the chair. Spread both legs 3.5 to 4 feet apart. Chest and navel up. Stretch the trunk. Bend forward. Rest the forehead on the seat of the chair. Adjust the distance properly between the chair and the foot. Both legs straight. Rest the forehead and stretch both arms. Keep the arms straight. Neck relaxed. Forehead rested on the blanket. Do not buckle the trunk. Do not flex the trunk. And watch your breathing. As we inhale, abdominal cavity should expand. As we exhale, it should contract. Eyes gently closed. Relax your tongue, nose, throat and the jaws. Be strong on both the legs. Feel the relaxation. All rested forward bends tend to induce better sense of relaxation. The posture is also good for the heart and the lungs by virtue of the movement of the diaphragm. It's important to use the breathing. Slow inhalation, allow the abdominal region to expand. Slower exhalation. Flex the arms, press the palm on the seat of the chair, slowly get up. Join the legs. Now sit upright on the chair, sit to a side. Inhale, exhale, turn. Give a gentle twist to the trunk because in an effort to bend the trunk forward, if you have not done it from the hip, there could be some stress at the lower back. So twisting relieves any such stresses in the lower back. Breathe well. Slowly come up and change side. Hold it out of the chair, inhale, exhale, turn. Prasarita Padottanasana done this way, that is resting the forehead. Reduces several stress related problems. Watch your breathing. Slowly come up. Sit upright. Chest and navel up. Palm should face upward. Tip of the thumb and index finger in contact. Keep both the feet properly placed, parallel to one another. Do not lean against the backrest of the chair. Have complete postural awareness. Watch your feet, the toes, contact between the ground and the foot, the toes, the arch of the foot, the heel, the ankles, legs, knees. Be watchful. You must scan your body. Watch the thighs. Watch the contact surface between the thigh and the chair. Watch your hips. Watch the contact points between the hip and the chair, where maximum load is getting transferred. Load of the trunk. Watch the groin, root of the thigh. Watch the pelvic cavity. Watch the abdominal cavity, front, side, and the back. Just pay attention. Can you feel the movement of the diaphragm? Diaphragm is the major muscle of breathing. As we inhale, the diaphragm presses the abdominal viscera down and the abdominal region expands, and then the diaphragm relaxes into the chest. Air comes out, abdominal region recedes. Now watch your chest cavity, the ribs, the intercostal muscles, the top of the chest, the clavicle, collarbone. Watch both the shoulders, upper arms, elbows, forearms, wrists, palms, fingers, fingertips. Pay attention. Keep the mind focused. Then again, the palm, wrists, forearm, elbows, upper arms, shoulders. Watch your neck and the throat, chin and the cheeks, the ears, lips, nose, eyes, the eyebrows, the temples, the forehead, the complete skull cavity. Just pay attention. Be a witness to all this. You watched your body as a witness. Just feel the relaxation. In doing this, you must use your mind and hold the attention. Mind is very dynamic, very turbulent, and by focusing your attention onto each individual parts of your body, you must help the mind to anchor onto these so that the mind does not oscillate into the past or future. Namaste.